Assalamualaikum and good morning. We from group B4 want to present about ophthalmic eye drop. Okay, let's start. The first eye drop is Gansy Clover eye gel. So I want to explain about what is active ingredient, dose, and inactive ingredient for this Gansy Clover eye drop. So the first is the active ingredient of Gansy Clover eye drop is Gansy Clover 0.5% week over week, or each gram gel contain 1.5 milligram of Gansy Clover. So next is dose for Gansy Clover eye gel is used for each group, adult and children 2 years of age and older. You should put 1 drop affected eye 5 times a day every 3 hours until the symptom improve. And children younger than 2 years, you should the dose must be determined by your doctor. And the last one, inactive ingredient, also carbomer, sorbitol, sodium hydroxide, benzalkonium chloride, and purified water.
Okay, I want to present about the second drop for eye drop is homatropin. The active ingredient for homatropin is hydrobromide 5 to 0%, benzalkonium chloride 0.005% as preservative. Second dose for eye drop is mydarasis and cyclophagia for repression. For adult, as homatropin hydrobromide 2% or 5% solution, instill 1 to 2 drop into affected eye immediately before the procedure. Repeat after 5 to 10 minutes if necessary. Child 3 months as homatropin hydrobromide 2%. And the last inactive ingredient such as boric acid, adiated disodium, potassium chloride, and water for injected.
Next, I want to present about fusidic acid eye drop. Okay, basically the function is as an antimicrobial treatment for eye infection. They help to eliminate bacteria causing infection in the eyes, providing relief for discomfort and aiding in the healing process. Okay, full-time eye drops contain the active ingredient fusidic acid, basically usually 1% of the active ingredient. For adults and children, it's recommended to put 1 to 2 drops in the affected eyes 2 or 3 times daily. The drop also have other things like preservatives and stabilizers. The strength is 1% fusidic acid. The packaging used is a small pipette or dropper for dispensing liquid. Thank you. Next,
I will present about the active ingredient, dose, and inactive ingredients. The active ingredients in azithromycin eye drops is the active substance is azithromycin dihydrate. Each gram of solution contains 50 mg of azithromycin dihydrate, equivalent to 14.3 mg of azithromycin. Each single dose container of 250 mg solution contains 3.75 mg of azithromycin dihydrate. Dose of azithromycin eye drops to be used for each group. This medicine is intended to be administered into eye. Always use this medicine exactly as advised by the doctor or the doctor treating the child. The recommended dose for adults and including the elderly and children from birth to 70 years of age is 1 drop twice a day in the eyes, once in morning and once in evening. Inactive ingredients in azithromycin eye drop is triglycerides and medium chain.
The last drop for eye is bromphenic eye drop. The active ingredient is bromphenic sodium equivalent to bromphenic 0.09% benzalkonium chloride solution, 0.01% weight in volume aqueous buffer. The dosage of each group for ophthalmic dosage form for the treatment of inflammation and reduction of pain in patients undergoing cataract surgery. For adults, as 0.09% ophthalmic solution, instill 1 drop into the affected eye once daily, beginning 1 day before surgery. Continue on the day of surgery and for the first 2 weeks of the post-operative period. For children, use and dose must be determined by your doctor. The inactive ingredient for bromphenic eye drop is boric acid, disodium edetate, polysorbate 90, providone K30, purified water, sodium borate, and sodium sulfite anhydrous. Thank you.